Many contact sports have faced one major issue, and that is concussions. A doctor by the name of Dr. Bennett Omalu greatly changed the way concussions are looked at in the NFL. Dr. Omalu looked at one football player by the name of Mike Webster. Webster was a Canadian football player who played in the NFL as a center for the Pittsburgh Steelers and the Kansas City Chiefs. He is considered one of the best centers in football history. He also received an award for the Hall of Fame. Webster was the first former NFL player to be diagnosed with CTE, a major brain issue. Since his death, he has been largely recognized as a symbol for head injuries in the NFL. Dr. Bennett Omalu, a physician, forensic pathologist, and neuropathologist, was the first to discover and publish his findings on CTE in NFL players. Dr. Omalu holds 8 advanced degrees and board certifications. Dr. Omalu lived in New York City, where he joined Columbia University's Harlem Hospital Center for a residency training program in anatomic and clinical pathology. After residency, he trained as a forensic pathologist under noted forensic consultant Cyril Wetch at the Allegheny County Coroner's Office in Pittsburgh. This is when Omalu became interested in neuropathology and study of the brain. Omalu is currently Chief Medical Examiner of San Joaquin County, California, and is a professor in the UC Davis Department of Medical Pathology and Laboratory Medicine. Dr. Omalu's autopsy on Mike Webster led to awareness of CTE in the NFL. Webster died after several years of dementia caused by repeated blows to the head during his time in the NFL. Using special staining techniques, Dr. Omalu found large accumulations of tau protein in Webster's brain, which affected emotion, mood, and even executive functions. Dr. Omalu published his findings in the journal Neurosurgery in 2005 in a paper titled CTE in a National Football Player. CTE, which had previously been described in boxers and other professional athletes, was soon being noticed in national football. Omalu believed that the National Football League doctors would be pleased to read his article, and his research could be used to fix the problem. The paper initially received some attention, but members of the NFL's Mid-Traumatic Brain Injury Committee later called for its retraction in May 2006. Their letter requesting the retraction characterized Omalu's description of CTE as completely wrong and called the paper a failure. Omalu later published a second neurosurgery paper based on his findings in another NFL player who suffered from depression and committed suicide in 2005. Omalu also found tau protein concentrations in this football player. While the NFL originally rejected his ideals, Dr. Omalu's findings changed the way that the NFL looked and handled head injuries. He concluded his research by saying repetitive head trauma chokes the brain. Since Dr. Omalu's findings on Mike Webster, the NFL has gotten better with dealing with head injuries, but today many players still refuse to take all necessary precautions. Treatment of concussions consists of pain medications and activity modifications. There's no specific cure for concussion. Rest and restricting activities allow the brain to recover. This means one should temporarily reduce sports, video games, and TV, or too much socializing. Medications for headache pain or other anti-nausea medications can be used for symptoms. Many players in the NFL do not follow the concussion protocol and are seen returning after major concussions. Dr. Omalu changed the way the NFL deals with concussions, but there is still much to be learned.